Hey everybody, this is Tim Ashe, President of the Vermont State Senate, with you for my daily update on Vermont's response to the COVID-19 pandemic. It's Thursday, May 14th. Today we're going to be joined by two great guests to talk about the impact COVID-19 has had on meeting the needs of families who count on a number of different supports to allow them to either be in the workforce or to get kids the early education that they need, or the various mental health services that they need, food, nutrition, the whole range of services that really are critical to allowing some people to really live up to their potential starting at the earliest stages. So we have Amy Johnson from NCSS, which I'll let her describe the acronym in a moment, and Donna Bailey from the Addison County Parent-Child Center. So thank you guys both for being here today.
Thanks for having us.
So I'm going to start maybe, Amy, with a question for you. Before we start turning to the real substance here, parent-child centers are a term that many in the legislature are familiar with because there's a network of them in the state. But I suspect that the average person who hears the term parent-child center has no idea what they really are, or thinks, oh, it's just a childcare facility with a different name. Can you just say a quick word first about what NCSS stands for and where you work and what you do there, but then tell us a little bit just about what makes a parent-child center different than a conventional childcare or early education center?
Yeah, absolutely. So I work at NCSS, Northwestern Counseling and Support Services, and I oversee parent-child center programming there. We're the only parent-child center that's embedded in a mental health agency. So NCSS is a community mental health agency. We provide mental health supports and services in the community, homes, schools, and at the office for young people all the way up to older people. So pretty much everybody who lives in Franklin Grand Isle. So that's NCSS in a nutshell. I'm glad you brought up the parent-child center question. We get that a lot, that when I say I oversee a parent-child center, people think that I run a child care center. And NCSS is one of the few parent-child centers that doesn't have a child care center. But we, parent-child centers are offering prevention, early intervention, early identification services for families. What links all 15 of us across the state is our 8 core services. So we offer playgroups, parent education workshops, parent support groups, concrete support, information and referral. We do a lot with working with our community partners to build a better early childhood system to support families. So we offer a lot for families. Many of us run child care centers, and if we don't, we're supporting the child care field, the early educators in our regions. So we do a lot. I mean, that's just the 8 core services, but what that means is really wrapping families with the supports that they need. There's targeted supports for families with specific challenges, and then there's universal supports for every family. So we do a lot. Childcare is really important, and we do that and more.
So Donna, if someone said, okay, you're in Addison County, if the Addison County Parent-Child Center didn't exist, couldn't those families just be served by somebody else? What would your response to that be?
My response would be, by whom? who would serve them? So I think many of us go into parenting or start a family without a lot of experience. And some people have the skills and knowledge and are able to do that, and other people need support and help. You know, I think all of us have the best interest of children at heart. How to get there is the question. So lots of people, I think, need support. And I don't think anybody who's parented thinks that it's easy to do alone. So I think, and some of us need more supports than others. So I think, you know, when you talk about a child care program, you know, you're thinking about the little kids, but they're always attached to parents. So we, as parent-child centers, make sure we're helping at least 2 generations at one time.
Okay, great. Well, that gives us a foundation for the discussion we're about to have. So it's, I believe, 2 months and a day ago, the legislature closed the State House because the governor was issuing a state of emergency order. And we all started to have an even more acute sense of how serious the public health threat was. And obviously, a lot of the work that both of you do is in person, directly interfacing with kids and their parents. So, Donna, at what point did you and your staff appreciate that in-person activities were going to not be allowed or would be substantially curtailed? And what was that like to have to confront that fact and immediately shift the way you try to meet people's needs as best you can?
Well, I remember it well because March 16th was a Monday, and over the weekend things had, become clear that we were going to head towards a shutdown and schools were going to close, and so we thankfully actually that day had a staff in-service day, so we just sort of turned it all upside down that day and really worked together to figure out how we were going to reach our families, how we were going to shut down, and we closed after that day. So we closed down and we really figured out each of our families have support outreach workers who are social workers, home visitors. They also have child care givers, and for those of the kids that are in our child care program. And we have an education program for high school for parents. So we have lots of ways to connect, and all of those staff are connecting with the parents as well as children. So pre-K children, we started Zoom classes, just a couple of meetings a week. We have a private Facebook page where we read stories and sing songs, and they see our faces and we see theirs. There are private individual classroom pages for babies and such that we do that they can see each other. And then we decided we were going to get supplies out, because although we know that people need food and there's been a huge help around the community to get families food, we also know that those taxable items, so that we call them, those supplies, cleaning supplies, things like diapers, wipes, all of those things that we had to help get to families. So we've been sending out boxes, over 100 a month. We're trying to do that really safely. They also always have a theme with art or this month is toys, and Wow Toys from Virgins gave a big donation. So we're able to do that, and we're getting books out and things like that. So really trying to meet families where they are and asking them what they need. And we're able to connect. I think what we found we had to do first was get people phone cards. The infrastructure issues for people who live in poverty in Vermont, and for all of us, are in some places. But if you don't have money to connect, it's really difficult. So really helping people to connect to the internet was the first thing we did, and then getting people supplies.
So Amy, in your neck of the woods, same shock to the system. Everyone realizes that the normal way of delivering services is being rudely interrupted. I don't want to say how smoothly did the transition go, because I don't want to prejudge that it went smoothly, but what was that transition like for your peers up in the northwest corner of the state?
It's interesting looking at how we're integrating some of our work back into the office. We're finding that feels, looking back, more complicated than when we were moving to remote services. But it was, we kind of saw this coming at us. And so we thought, what are going to be the things that are going to be really challenging for families? So right from the get-go, we started to order wipes, formula, baby food, baby supplies, toys, different things for families that we thought that they may need. We reached out to the Chittenden County Diaper Bank, the Junior League, and said, give us as many diapers as you possibly can. That's already an issue in our region. So we kind of stockpiled supplies, started writing emergency COVID-19 grants to be able to get funding for phone cards. Like Donna said, we have a lot of families who aren't on phone plans, and when we call them to provide therapeutic services, it drains their minutes. So for a lot of families, we're like wanting to at least text message with them to know that everything's okay. Families experiencing domestic violence, making sure that they can stay connected, getting grocery cards for families for when they needed them. So we really did a lot of forward thinking about what is this going to look like, what might happen, and let's be prepared. And there was just a lot of communication with getting people home and helping them to get connected, making sure that we were paying attention to the guidance to be able to do telehealth and not be in violation of HIPAA. So it was just so many moving pieces, but I will say that the team up in Franklin Grand Isle are just absolute rock stars. I mean, they just, we send out guidance and then an hour later we'd say, actually, we're going to do it differently, or we can't do it that way anymore. Something from the state has changed because this is new to all of us. So
yeah, I can tell you those first days were, just whirlwinds of change and new information and new expectations of what would be the next step. And telehealth and telemedicine are a good example. The legislature tried to move as quickly as possible, but I think there were probably 5 different policies in 10 days, and everyone's scrambling to meet people's needs. And some of your clients presumably are in real need of that continuity of treatment.
Yeah, absolutely.
And to have the interruption really sets people back. So it's just a remarkable turn of events. Donna, I know that just like our public schools and our higher ed institutions are all trying to make the best of the situation and do what they do remotely. And it's while it may be super admirable, the transition to distance service, it doesn't necessarily mean that there aren't consequences of doing things remotely. If, from the point of view of someone who serves families who don't have much in terms of resources, have various challenges that you're helping them overcome and succeed, what have been some of the sort of the downsides or negative consequences of having to have your interactions, using technology rather than in person?
Well, I think that a couple things, because I think when you're working with families who have lived in generational poverty in Vermont or anywhere, but here, many of our families are used to not having a lot and used to staying home because they can't afford to go do lots of things. So for some in the beginning and sort of through this time, I think we've seen a lot of our families doing pretty well staying at home. However, again, having little children under feet 24/7 and not having support around that is tricky, and not having activities or things to do, and it's really hard. So how to talk, what does no mean, all of those kinds of things. So we're really working on helping with those parenting skills. But I think we don't know yet what the impact of this is. We don't know. And I think for our staff who are used to really human contact, and that's what we all do for a living for a reason, it's been really hard to be so apart from the families. And I think for families, again, I'm concerned that as we sort of move back together, there's going to be a lot more families who need help and need support, because again, many of the families who were living on the edge already are very resilient and resourceful, and we are helping, and we have identified, and we're there in some way. I think none of us know who else is going to sort of fall out in this around, economic resources and mental health and other things. So.
Sure.
I think that,
yeah.
Sorry,
Go ahead.
I just want to add to that. I think one of our major concerns are the families who we haven't been able to connect with because they have internet or technology barriers or don't have access. And so there's a handful of families or more that we just haven't been able to access because they don't have the tools to be able to participate in telehealth or remote work. And then I think about families who are at home, just in general, families not getting the respite that they need. Like Donna said, kids underfoot 100% of the time. Families who have children with, developmental or medical barriers, not getting the respite and the support that they need. And really, we're thinking about families who just had a baby. The last in-person interaction they had was at the hospital. They've gone home and now they're in the postpartum period, which is a really critical time and really challenging for most families. And to think that there isn't somebody coming in who's holding your baby so you can have a rest, that respite that's so needed, we're seeing families, the onion really peeling for a lot of families.
When you were talking, Amy, about people who you can't access because they don't have either phone or computer access to connect with you, are you referring to people who you're existing client, like people you already serve, or people who may now need services that you offer, but that you previously hadn't had a relationship with?
Yeah, it's definitely both. And we were concerned about our families who we have, tried to contact through phone and we're not able to get connected to, but we're also worried about the families. We know that a lot of families are struggling, families that maybe weren't previously, and now one or both family members have lost their jobs, are food insecure, aren't being able to find the resources that they need. So we're working with our community partners. Our most childcare centers and registered home providers are closed, but we know a lot of kids are in those centers and homes normally. And so we're reaching out to those providers to say, who are those families who you might be concerned about? What are you hearing in your community, or in your small areas of our region, to see it? Are there families who we can use other people to help us connect to those families? Because we are really worried about families we're currently working with, but also all families.
Okay, well, I've got a few more questions for you guys. And Donna, let me ask you a question sort of before we turn to how you see the challenges about reopening or what that even means at this point. I feel like one of the things that both of you are, one of the fundamental questions that both of you are, the work that you and your colleagues do raises is kind of, why does the public sector support programs like what you do? Why is there an investment of both state and federal tax money to have these special sites that meet the various challenges that kids and parents face? And taking a hypothetical position of some in the community, they might say, well, heck, let these families figure it out on their own, right? When I grew up, my parents didn't know what they were doing, but look at me, I turned out okay. Why can't everyone else just get it right? And so, Donna, can you just say a word about why you think it's in everyone's interest to have centers like yours be able to provide the range of services you do? Why it's almost like public health. I think more people appreciate now that public health is about taking personal actions that benefit someone you don't even know. Why is it benefiting someone who isn't one of your clients that you have the ability to successfully operate the range of services you do?
Thank you for asking that, because I think, all things aren't equal, as we know, and things, economic justice is important, social justice is important to me, and I think educational equity and all of those things. So making sure, we live in a land of plenty, but not everybody has plenty. So I think parent-child centers help level the playing field around families getting off to a good start. So helping people have the resources, skills, and ability to move into self-reliance. So to be able to be economically self-sufficient, you have to have education and all of those things. So to make sure that families are getting that. We know that when we work with young children and do prevention work, which is much less expensive than treatment or intervention, when we can do that early on, kids are better off. I've seen it. I've been at the Parent-Child Center for 22 years in Addison County, and I have seen literacy rates go up because we have education programs and we have high quality early childhood care. I see adjudication rates staying low, so youth aren't going into corrections. We still, I see more kids in the sports pages when we have sports than
That's a
day
sore subject right now.
Yeah, then day in court though. And that's what we need to keep up. So when we think, about why, we think about, Vermont can be like living in a state park if we have the equipment and all that stuff to play out there, right? So, but that's not true for everyone. So until it's true for everyone, I think we need to work on that as a society. You know,
Yeah, I think, I often, when I'm talking with people who maybe aren't particularly politically motivated, but people who have sort of passive observation of government, and when they question a particular program that I might support, I often will try and turn it into a practical question, a problem-solving question, and say, set aside the philosophy or your core belief in personal responsibility versus collective responsibility. The question is, are there families who need help? And if the answer to that is yes, there's two choices: help them or don't help them. And what are the consequences of both?
Exactly.
Helping them requires public expenditures in the near term. Not helping them means public expenditures for the long term. And
Absolutely.
getting programs correct is always the sweet spot. You want to make sure you're doing things right and successfully and actually proving the case. But I feel like many times the common ground is solving the problem rather than the deeper philosophical questions about, who should be responsible for what behavior. But in the time remaining, I want to talk a little bit about what you see as the transition from where we're at to where, I don't know where we're headed, so I can't even say what that means or when. But Amy, right now you guys have had to fundamentally shift your operations. Families are the ones you're able to continue to reach, are responding in various ways, and your best efforts hopefully are helping bring out the best of those experiences. What do you see as some of the hurdles, from where we're at now to getting back to a level of service which you normally are able to offer? What are the real challenges that you're going to face?
I'm glad you asked that. We're actively working on this at NCSS right now, and it's going to get loud because the jets are going to go over me as I'm talking. We're actively working on this right now, and a big piece of this is around the safety of our staff and the safety of the families who we work with. Thinking about, if we're going into the home, how are we making sure that we have the PPE that we need, that the family has PPE, that we're able to, thinking about all those pieces around disinfecting and hand sanitizing when you go in, and how long do you stay in? If you're 6 feet apart and both wearing masks, but you're in a confined space for an hour, what does that mean? And then how do you structure your day so that you're not going from home to home to home into the office and kind of bringing a potential contact with the virus to the multiple homes and then into the office? And so how navigating the safety for staff, navigating the safety for the families who we work with is just paramount. And that's really, and then thinking about, we need to get in to work with some of our families. Like I said, the onion is really peeling for a lot of our families. So how do we work to prioritize who are those high acuity, high need families who we've had really little contact with, who we really need to prioritize? So right now we're looking at, as we're moving from kind of the stay home, stay safe, telehealth, to kind of the yellow zone, where we're prioritizing who are those families that we're going to be getting in the door with first, and how do we kind of blend our day with telehealth and some in-person or community supports in a safe way. And so it's a lot of things to, every question creates, 20 new questions. So it's been a really interesting adventure to navigate how we start to support families in person.
And Donna, so from the point of view of one of the families you serve, how, as they look to an uncertain next few months ahead, try to give us some sense of what the uncertainty means to them in terms of their quality of life and ability to successfully navigate the next few months.
Right. Well, we've been asked to open June 1 for our childcare program. So that's the first sort of phase of looking at that. And honestly, I'm not sure what we're going to do right now, because we've done a lot of talking. So I just talked to we've talked to every one of our families in the last couple of days. And so yesterday, for instance, a young mom, she's on Reach Up, which is the Welfare to Work program. Her worker said as soon as the place that she's working doing her Reach Up hours opens, she has to go back to work. So she has to have childcare. We don't know exactly when that is, but she's struggling with the fact that she's really concerned about sending her child to childcare this summer. Why does my baby have to go when school age kids can stay home till the fall? These kinds of questions, which are the questions we're all asking, every parent is asking, no matter what our resources are. But some people have choice and some people don't. So somebody who's got public welfare does not have a choice around where their child's going to be. And to me, that's a real equity issue. And I'm concerned about that, because I think she has the right to have some fears and concerns, because it's scary. We know that numbers are low for kids, but we don't know where this is going. So it's scary stuff. So that's just one example of, so she'll have to go back to childcare, and she's not really ready to. She's like, I wish I could go in the fall when we think, or we'll know more then, kind of thing. So people are all trying to make the best decisions with the information they have.
Yeah, it's going to be especially for childcare, for schools, the uncertainty. It's people who run for public office. When they're in office, they often wish to be able to say they have every answer. And it has been the most unusual 2 months, because we've all had to say, those of us who serve in Montpelier, whether it's the governor down to the 180th tenured legislator, have to say, I don't know yet,
right,
to many of these questions, which are critical to people's lives and moving forward. And one of the interesting things, which I'm sure has impacted some of the families you serve, is the way unemployment has been deployed by the federal government and the state. And of course, it created all sorts of eccentric outcomes, including some people being able to stay home and make more money than if their
right,
coworker who works. Now, on the surface, you say, well, if it's safer to be home, that's great. And if the federal government wants to pump $600 a week into people's pockets, that's also great. However, the way the changes have been made, if you have a kid who's home because the child care or school's closed, you could stay home and collect the benefits. If you did not have a child, you could not qualify for unemployment, even if you had just general safety concerns. So it's created a number of those kinds of,
right.
I don't want to say, using my example, it's an inequity, but it definitely is different factors affecting people's sense of security and safety. And especially now, if you're a childcare facility and you need 10 kids to make it economical, but all 10 families are going through the calculation you just described about whether they feel comfortable sending their kid. But then if you don't know you're going to have 10, do you open? And,
exactly.
And if you open and you're losing money, who's going to make up the difference? And so I don't envy anyone going through these decisions. And the great challenge for all of us is to partner together and figure out how to get through this and keep as many people safe as possible. So I want to thank you both for joining me. I think it's, the demystifying of what a parent-child center is was our first objective, which I think you've accomplished very well. And also really talked about why these services are so important in general to the greater public good, but also the unique challenges that you've faced trying to meet these needs in unthinkable conditions. But sounds like you're doing admirable work. And I know that the people who work in your organizations don't do the work to get rich. I don't think. Otherwise, they stay for one day and then they see their parent go home. But it's not because the work isn't tremendously valuable. So I just want to, on behalf of the Vermont Senate, thank you guys so much for everything you do. And I'm going to sign off with everyone watching at home, and hope you'll check back in tomorrow at 5:30, where I'll be doing some end of week updates about what's transpired in Vermont. And I hope you continue to do everything you can to stay safe. Good night, everyone.